Welcome back to the program. Well, when you think of strokes, which are Australia's second biggest killer, we automatically think of victims being adults. We certainly don't think of a baby as a victim. Well, that is what happened to baby Indiana. In fact, she had a stroke while she was in her mother's womb. Indiana suffered a stroke. It then went on to cause up to 300 seizures a day. I'm joined this morning by Mum Tammy, little Indiana, and from the Stroke Foundation, Dr Erin Lalor. Good morning, everyone.
Good morning.
Tammy, when you were carrying little Indiana, did you feel anything different? Did any tests show anything out of the ordinary?
No, not at all. I even had the knuckle translucency scan when I was 12 weeks pregnant, which shows abnormalities, and that was clear. And it was later brought to our attention that she had the stroke sometime in the third trimester, and she had, yeah, that's when we discovered it, yeah.
After she was born, it was about 3 days when you realised she had some serious health issues. What happened? How did they tell you, and how did you find out?
She had an intracranial ultrasound done at the hospital, and the doctor just said that she'd had a brain hemorrhage. That was all we were told at the beginning.
What did you think that meant?
We weren't really sure.
Did you know a brain hemorrhage was in fact a stroke?
No, not at the time. We didn't realise that until she was 5 months old, that it was actually, that's actually what it was. I don't know if that's just being naive or whether it was just us not being aware of it. We hadn't been around anyone who had been in that situation, so, yeah.
And how rare, Dr Lalor, is a baby having a stroke?
Well, we see in every 100,000 children, we see about 2 having a stroke. So it's not common in young children. But having said that, the Royal Children's Hospital in Melbourne has a stroke unit because they see enough strokes in children to justify a specialised service.
What does it mean to little Indiana now, having had a stroke? What are the health issues she faces for the rest of her life?
Well, I think Tammy and I have been talking about that this morning, and the biggest challenge from Indiana, you can probably speak to it better, is learning to live with difficulty moving one part of her body as easily as she used to.
Yeah. So explain what condition she's left with and will continue to live with.
She's got left hemiplegic cerebral palsy, and which basically means that the stroke was on the right side of the brain and affects the left side of the body.
So she can't move one arm?
She can, but she won't have a lot of use of that arm, of the right arm. She has difficulty walking.
Look at you, that's you there. Indiana, have a look, that's you. Wave. There you go, wave.
And she developed epilepsy at 3 months. And that was caused from the same part of the brain where the stroke happened is where the seizures actually started from.
So how do you continue in terms of medication? What have the doctors told you to look for, and how will it work for you and your life and your care?
They sort of don't really say too much about what the future holds because every baby's different, every child's different. We were told in the beginning that, you know, she probably would have some difficulty moving the left side of her body, but that was pretty much all we were told, and the rest of it really happens. It depends on the child, and it depends on their treatment, and she gets a lot of early intervention.
Physiotherapy, etc.
Yes, from early intervention services, and we go to attend playgroup, which is great for her to be around able-bodied babies and just to learn through play. Indiana goes to a chiropractor, and she's hopefully starting horse riding and hydrotherapy shortly as well.
So really nothing's holding her back. It's just a different way of doing things. And this is an important message for people with strokes. As I said, normally don't assume babies will get it, but we do know young adults, and most especially older people. What's the most important aspect of recognising a stroke? Now, obviously impossible with a baby. To recognise a stroke and get treatment as quickly as possible, within how many hours?
Well, it's really important that people, when recognise a stroke quickly, it's important to act fast.
Literally in hours?
It is. So there are treatments that must be given within 4.5 hours.
And what is that treatment?
And that treatment's a clot-busting treatment, and it's given to strokes that are caused by a clot. So Indiana had a bleed in her brain. It's not used for that type of stroke, but the clot-busting drug must be given within 4.5 hours, and the earlier it's given...
So get to that hospital, get that stuff.
Remember fast.
I'm talking to somebody and they are in the middle of having a stroke. What am I seeing?
So you'll remember The word FAST will spell out the signs to see. So F for facial weakness, A for arm weakness, S for speech difficulties, and T for time. So if someone's got difficulty speaking, difficulty moving one side of their body, if their face is drooping on one side,
And some of these
time to act
conditions they wouldn't
fast.
even know they're experiencing.
That's right.
It's for somebody else
That's
to recognise
right.
it. Important, critical information for everybody. Tammy, thank you so much. She's
okay.
coping well. You're clearly coping well. Congratulations on that. It can't be easy.
No, it's not.
But
Not at all.
You clearly have adapted and you have such a great attitude, and thank you for sharing that
Thank
this morning.
you.
Good morning, Indiana. You're going to make a phone call now, darling? Making a little call?
She's the battery's about to go flat.
Dr Erin Lalor, thank you. Thank you,
Thank
Tammy.
you.
Good morning, Indiana.
Thank you.